All right, so PPE and asepsis. So first, healthcare associated infections are estimated to affect 1 out of 25 patients in the hospital setting and the fourth leading cause of death in the United States. Boy, that's a lot, huh? Now, anytime we talk about death and in the hospital setting, who goes to hospitals? Sick people and medically fragile people. So I'm always, it's very shocking. And it's definitely something we want to prevent, but it's also the most vulnerable population. So I take it for what it's worth. But 1 out of 25 patients in the hospital affected by some sort of hospital acquired infection. Now that is staggering to me. So, as PTAs, we can be providing direct wound care with, especially in the burn unit. But the big thing is we get close with our patients. We are physically close with our patients. We saw.
All right. But do any of the hospitals have like a burn unit specifically in Rhode Island?
I don't know of a single burn unit in Rhode Island. I'm sure that there are.
Yeah.
It's definitely, I don't know of a specialty unit. So when my wife worked in Cincinnati, she worked at Shriners Hospital, and their whole hospital was kids with burns. That was that hospital. So I don't. It's definitely not something like that in Rhode Island. No, it's okay. So while we're on that topic with burns in hospitals, why do you think that PTs and PTAs deal with burns in the hospital setting a lot more? Because as the skin is healing, we want to make sure we avoid contractures. That's the big thing. So if there's a burn and it crosses the joint, boom, PT is definitely involved in the case. Now, what's the big risk for burns? Infection. What's one of the ways we prevent infection? PPE, we'll learn about today. Very good. Anything else? Any other? Hand washing, definitely. Yeah, so we can do a lot with the environment. Yep. Yep, we'll be cleaning the wound and debriding dead tissue. Yep. The other easy one is minimize the number of people involved with the case. So if we minimize the number of people involved with the case, do PTs and PTs have to be involved in the case? Yes, because we have to prevent those contractures. Nobody better to do it. While we're in there, we're going to be performing a lot of the other tasks of other providers. So we're going to be potentially administering medications, debriding wounds. We are going to be taking place of a lot of other people in that unit because we're trying to minimize contact. Now, that's with burns and wounds, but how close do we get with our patients? Physically close. With all of our bed mobility, all of our transfers, I mean, we are high school dance close, right? So yes, we have a responsibility to protect not only the patients, but also ourselves too. We want to be healthy over the weekend to take our kids to the cider factory. We want to, go to work the next day to help the next person. So we want to protect ourselves as well. So standard precautions for prevention include frequent hand washing, hand rubbing before and after each patient treatment. Every single hospital and skilled nurse facility I've been into, there's some sort of hand sanitizer on the wall, and you do it when you enter the room and exit the room. And in front of the patient, and everybody it should be obvious to everyone what you're doing. Proper hand hygiene, we'll look at a little bit other techniques for that. And then personal protective equipment, PPE. Could be anything, including caps, booties, masks, respirators, eye protection, gown, gloves. We'll look at when we have to use those and when we don't. Although in the last 3-ish years. A lot of it's just been wear everything. And we'll look at some of the other, I'm not sure what we're doing in hospitals right now. But I'll show you some of the hospitals want to pay for disposable PPE for every single visit. That's a lot, right? So hospitals don't want those expenses, but we also don't want to have patient-acquired infections. So I'll tell you how we decide some of that in a little bit. Now, some reason caregivers may avoid proper precautions, a perceived lack of time, and man, that can definitely happen. There's a productivity that we have to abide by, and everybody's always busy. So perceived lack of time, poor access to items, they're not in the right place, they're not the cart outside in this wing of the hospital is empty. I don't want to have to go to the other wing to go get this stuff, because that adds to the lack of time problem. Poor location of sink for washing hands, lack of appropriate sized apparel, which we'll have maybe today in our lab for some people. Here's the big one: dermatitis caused by frequent hand washing. You guys, we're getting into the winter season, whose hands in the last few years have just been mangled with all of the hand washing and sanitizing? So how many people, everybody's done this, I'm sure. You throw on some hand sanitizer, you go, I didn't realize I had those many cuts in my hands, right? So yeah, not fun. Other allergic reactions to soap and detergents, reactions to latex. Anybody have a latex allergy in here? So some people do. Lack of understanding of the importance of using infection control, and poor motivation to comply with policies and procedures for other reasons. I'm mad my boss didn't give me my time off on Friday, so I'm not going to wear PPE on Thursday. Like that's the kind of thing. And I know it might sound silly, but somebody's worked with someone who's done that kind of stuff, right? Am I the only one that has that coworker? Yeah. All right. I can count on T for nodding with me when I need it. Good. So in 2007, the CDC expanded on isolation guidelines to prevent infections, transmission across healthcare settings. Special concern of specific diseases, including coronavirus, MRSA, C. diff. So MRSA is a big problem because it's resistant to antibiotics. C. diff, Ebola, HIV and AIDS, and hepatitis B, HPV. So all healthcare settings should follow these appropriate guidelines. Although in the hospital and skilled nursing facility, we have the most number of patients, the most medically fragile patients, all in the same area with lots of people going in and out of every single room. So we are a little bit more strict with some of these PPE in those settings than we are in others, but it's important for others as well. So important to look at changes to the guidelines. Don means to put on. Anybody know what take off is? Doff. Yep, one of my favorite. I try to incorporate that word into my 2-year-old doesn't quite get it yet. Scarlett, doff your shoes, please. And she just looks at me. I laugh. That's all that matters. So donning your PPE when entering the patient's room for contacts and droplet precautions, airborne. We don't want to be in the room without that PPE. We'll look at that in a little bit. The reason is because we don't want to put on our PPE and then touch a contaminated surface and then enter the room. So we like to eliminate that as a possibility. Coughing and sneezing etiquette. Sneeze into a tissue or use your cover cape, right? Dracula move. Not into your hands. So standard precautions are a group of prevention strategies that applies to all patients regardless of diagnosis, based on the principle that all bodily fluids and excretions and non-intact skins may contain transmissible infection agents. So just a verbiage thing. Excretion is removal of waste of the body. Urine and feces are the two easy examples of that. Secretion is movement of materials within the bodies, hormones, mucus, secretions, different lubrications of different areas. Hand washing should be done after touching any bodily fluid or contaminated items. Non-sterile gloves. So we have sterile gloves and non-sterile gloves. We'll look at how do we use sterile gloves in a little while as well. Non-sterile gloves, I'm sure is what. Has anybody had to use sterile gloves for any reason? It's unusual if you do. So all the gloves we've probably worn are non-sterile. Should be worn for touching any bodily fluid and contaminated items. I'm seeing more and more therapists using gloves every single treatment. All inpatient as well as outpatient as well. I think there's some good and bad to that. Good is we're preventing these kind of infections. Bad is what it makes the patient feel like. Some patients, it would make them feel a lot safer, and others, it would be, why am I such a problem? You have to put on gloves. So something we can think about. Wear a gown if there's a chance to be contact with bodily fluids, and eye protection if there's a splash risk. So transmission-based precautions are in addition to standard precautions. Standard precautions are every single person's going to get it. Just don't even think about it. Transmission-based precautions are for specific disorders, for specific diseases, have specific risks to it. So we have contact, which is the most common method of transmission. It can be direct or indirect. So I can touch my patient's open wound and get it, or I can touch their sheets who have touched their open wounds. So that's the indirect. Could be droplet, airborne, or airborne plus contact. So the cycle of infection, one, we start with the infectious agents, the specific pathogen, bacteria, fungus, more and more. It needs a reservoir, a place where the microorganisms can grow. Sometimes it's called a host. It needs to exit that host somehow. Nose, mouth, open wound, other bodily fluids. And then we need to pass it from one person to another, either with contact, droplet, airborne, or airborne and contact. It has to enter the next person via a portal. Eyes are the most common. Some sort of mucous membrane, a break in the skin, those tiny cuts that we have in our hands that we didn't know that existed until we put on hand sanitizer. And then the other thing is the other person has to be susceptible. So their body doesn't fight that infection quickly, either because the load that the person took in was high, or there's some sort of other reason we didn't fight it. Some people, anybody never get sick. It's rare if you get sick. Anybody's sick all the time. Yeah, so we have different abilities in our bodies. Some people just are. Anybody here not get COVID in the last 4 years? Yeah, pretty good. Anybody here have it like multiple times? Yeah, there you go. And I mean, we could come up with maybe some hypotheses on why. Could be lifestyle differences, or it could just be I'm not really susceptible to it.
One of my kids are.
Yep. Yeah, if you have kids, your risk of acquiring is a lot higher.
It's like my wife got pretty sick, but for me it was just like I had to get you.
Yep. So microorganisms grow best in a dark, warm, and moist environment. Less likely in cool, dry environments or extremely hot environment. Your clothes washer versus your dryer, which one smells funky every now and again? The washer. Does the dryer ever have that problem? Well, that's because the environment. Yeah, it shouldn't. Yeah, if it does, we got a lot of problems, right? Now, we talked about this a little bit. The patient that's incontinent in the recliner, what kind of environment is that? Warm, moist. I mean, the foam it's sitting in that foam. So yeah, huge risk of infection again for those patients. So it's up to us caregivers. The textbook uses the term caregivers a lot. Caregivers are us, right? We are providing care, we're providing the physical therapy. It's also, I like it because it's a really inclusive term. Any healthcare worker, but also family members as well. So it's a nice inclusive term. So if it's confusing to caregivers, just means you. So we'll look at the aseptic technique as well. Collection of practices to protect patients from microorganisms. Medical asepsis is what we'll be focusing on. Keep an area or object or person free of pathogens. Could involve isolation of a person. We have to pay special attention to the sequencing of donning and doffing PPE because we don't want to mess up the order of it. We'll look at some other things we'll have to consider as well. Surgical asepsis is now we're going to exclude all microorganisms before they can enter a surgical wound or contaminate the surgical field. We will look at this as well because there will be opportunities for you. I know as a student, I think we had 2 students in their first internship were able to sit in for some surgeries. So it's nice to know surgical asepsis. Nobody's going to be asking you, like, the surgeon's not going to say, hey, I'm a little tired right now. Do you mind just finishing this up? Like, that's not going to be part of it, but you should know of it so we can treat the environment well as well. So all personnel who enter the surgical field must perform surgical hand scrub with antimicrobial soap and then don sterile PPE. At the minimum for wound debridement, and again, PTAs will have a role with wound care. So we will be having to use sterile gloves and maintain a sterile field for that scenario as well. So we're looking at sterile gloves, sterile fields. We can look on page 28 for the comparison of medical versus surgical asepsis. So standard precautions include barriers, gloves, protective clothing, eye protection, face shield, and mask. Hand hygiene, we talked about this a few times already. You should be washing your hands immediately after glove removal, after touching any bodily fluid or contaminated items. Avoid wearing artificial fingernails because we can't clean the undersurface where the artificial nail touches the biological nail. So that will always be at risk for capturing microorganisms. So avoid wearing artificial fingernails. Avoid contact with outer surface of gloves when being removed. There's something wrong there. And wash our hands before and after patient care. Sharps, dispose of any sharps in a puncture-proof container. As PTAs, it'll be rare that you have to look at sharps, although my patients who are diabetic have needles. I think they're diabetic because there's needles all over the place, although there might be other reasons. So it's something we should be aware of anyway. I don't think in your professional field you'll have to use that much. Don't uncap needles until needed. We don't want to uncap the needle and just kind of start walking around. And use caution when handling sharps. It's great advice there. Miscellaneous other things: avoid eating and drinking, smoking, eye care and patient care area. Avoid contact with eyes, nose, and mouth. Avoid unnecessary contact with the patient. Really tough for us to do. And report incidents of contact with the patient of bodily fluid. So here's my chart on what the isolation type is some examples of reasons why we would have that, and what are the PPE environment and transportation requirements. So what is contact precaution? Contact is anything I could get if I touch it. MRSA is the big one that we're concerned with. C. diff is also very common. Impetigo, not quite as common, but still there. If we're going to be in a skilled nursing facility or a hospital, we want the patients to be in a private room or with the same condition. You could have people with, you know, everybody with MRSA in room 302. You could do that. Don't have to wear a mask because we need physical contact with it, right? We do need a gown and we do need gloves and hand washing with this special soap. I forget what this. I'll look in the textbook for what that is. That's the special antimicrobial soap. Minimize patient transport if we can. I think it makes sense. If the patient has MRSA and we're doing physical therapy, we're going to work on basic strengthening and bed mobility and transfers. We're probably going to be doing all of that care in the patient's room and not taking them to the PT gym to then contaminate all of the equipment in that gym, right? So, and I'll tell you, sometimes you'll be working with your patient for a couple of days, then you go to try to see them on Thursday, and all of a sudden there's a big sign in their room, contact precautions. You go, geez, I had my plan all ready for the gym. I got to switch up my plan now because now we're going to be in this room. Droplet precautions, mumps, good example of that. Private room, and we have to wear a mask when we're going to be less than 3 feet from the patient. So we will have to be wearing a mask. Maybe not every physician. I think a physician can do most of their job standing 3 feet away from the patient. So no gloves or gown, and then minimize patient transport for everything. Airborne measles and tuberculosis. Tuberculosis is a really fascinating condition. I'll let you in patho next semester. You'll learn a lot about tuberculosis. Private room with negative airflow now. So now anybody, I think in some construction projects, we have to have negative air. We're doing mold remediation or asbestos, or I don't think with lead you have to, but I don't quote me on that. My college professor said you didn't have to have negative airflow if you're doing lead remediation. Oh yeah, what was he teaching? Physical therapy. So we do want a mask, and this has to be at the level of an N95 mask. No gloves or gown required, and then with airborne plus contact, chickenpox, and coronavirus, we have to have everything. Negative airflow in the room and every single other, PPE. So hand washing, gosh, how many times have we talked about hand washing already? Before and after patient, before and after contact with wounds, dressing, specimens, bed linen, protective clothing, after contact with secretions, before and after toileting, after sneezing, coughing, blowing nose, after removal of gloves, and before and after eating. So you're washing your hands all the time, no matter what. Handles, towel dispensers, soap bars, edges of the sink are all considered contaminated. So we want to avoid contact, avoid unnecessary use of hands on faucets. You can use a paper towel as a barrier. So grab a paper towel as long as you don't come in contact with the dispenser. You can use that as the barrier to adjust the faucet. Most places, most facilities have automatic faucets now, but you'll never know when you come across something that doesn't. Remove all jewelry prior to treatment. Again, false nails we talked about already. Friction, very important for hand washing. Sometimes there might be some use for a one-time use wooden brush or orange stick for fingernails. Definitely if we had to have a surgical technique. But for most of the time, we won't need to. But friction, heavy friction is important. So there it is. Soap, antimicrobial germicidal agents, 2%. Who wants to give a crack at this word for me? What is it? Say it again. Chlorhexidine gluconate. That's the most common, but can cause some allergic reactions. So you just be aware of that. If it does, we have to switch what you use. So hand washing technique, we will be practicing this. First step, remove all jewelry except for smooth band type ring is allowed. So anybody have a wedding ring? So if it's smooth band type, then you're good to go. If it's got different jewels on it or different engravings on it, now that is not allowed to keep on. You have to take it off. So approach the washing area, but avoid touching sink and other objects. Really easy to, how many people bump into the front edge of the sink when you go to wash your hands, right? So we have to be really aware of that. And especially if our clothing is a little baggy, then now I'm coming in contact with that. So avoid that, turn on the water to the warm mix. Again, using paper towels as a barrier if we need. What we're going to do is we're going to wet our wrists and hands with the fingers directed downward. We're always going to be focused on that. Why is that? Exactly. All of the whatever's on our hands is going to be flowing off of our hands versus if we were to have more of an upward, it's going to be traveling, staying on ourselves. Apply soap. Automatic dispensers are best. Some places have foot controls, but hands-free is best. Begin to wash your hands with heavy friction or rubbing motions. Wash for at least 30 seconds. And repeat if there's known contact. So even longer if you know that you came in contact with a contaminated area. Palm and dorsum for at least 10 seconds, right? Palm, dorsum, 10 seconds. Interlace fingers for 10 seconds. Using that soft brush or orange stick on your fingernails if available. Wash distal 2/3 of your forearms as well with friction. And then rinsing from wrist to fingers directed downward. Do not rinse approximately where you washed. Why? So if we only, wash. So yeah, exactly. So now we're carrying, the water's going to carry the unclean area and it's going to potentially bring germs into our clean area. Now we got to do it all over again. Leaving the water running, dry your hands using a disposable towel. And then a new dry towel. We don't want a wet towel. The wet towel does not work as a barrier. Once your hands are dry, a new towel, you can then turn off the faucets. Okay. So we are going to practice this. So we have sink in there in both bathrooms. There's a few sinks as well. So pay attention to having really good technique. Okay. All right, let's give it a whirl.
For under the nails.
All right. So knowing how to maintain a sterile field is going to be very important for us. Couple reasons. One, we might just be the people assisting with positioning the patient so that someone else can do the wound care. We might be holding the patient and sideline so someone else can work on their sacral wound. If they have a sacral wound, if it's a pressure ulcer, which position were they likely in to get it? Potentially supine. There's one more at risk. Seated, be more specific than seated. Reclined is probably the best answer. Yeah. And why is that?
More pressure on the skin.
What is it?
Also like skin fold.
Oh, shear. It's the shear forces. That was the word I was hoping to find. Yeah, the shear forces of that reclined position at the sacrum. Good. So yeah, we might just be holding the patient while someone else does all the work. you might be performing the wound care as well. So it's important for us to really know of the sterile field. And you know what, on your internships, might be in the operating room observing a surgeon, some sort of surgery. So we should know of this stuff at the very least. That way we don't go and say, what do you call this thing? And we ruin everything, right? So it's important for us to know about it. So 4 rules of a sterile field: know what items are supposed to be sterile, know what items are not sterile, keep the two separate, keep sterile and non-sterile separate from one another. Why? Well, we could get confused, and then we have at risk for contamination. And then if a sterile item becomes contaminated, dispose of it, get rid of it, grab a new one. And it may be necessary to reestablish, start all over, throw everything away, reestablish this field. For in this room, and when we're doing our hands-on stuff, it is always okay to say, I don't like what I just did there. Can I try this again? I don't care if it's taking blood pressure. I just didn't quite get that number. Let me check it again. Great. Love it. With your patients, that's the same thing. I just don't like the number. Let me make sure I get this right. And then for us, I don't expect us to be experts at sterile technique and sterile, creating a sterile field. It's something that is less common for us to have to do than more. I expect us to be really good at bed mobility because that is, the job. So in this room, when we're doing this, either on comps or practicals, if we make an error, and if you identify that, that's really good. Identifying those errors versus being perfect is what I would expect for these techniques. Versus, bed mobility, you got to do a really good job because that is the thing you'll be doing a lot. So we maintain a sterile field. A sterile field, all we're talking about is an area where I can have all of the equipment and tools and bandages or whatever other things I need to treat my patient. So avoid sneezing, coughing, talking, or breathing over the sterile field. Don't turn your back on the sterile field. How many people, when we were doing our bed mobility up to the edge of the bed, then put a gait belt on, how many people forgot to have the gait belt right next to them and said to say, oh, I got to go get that, right? So guess what? If you create a sterile field and we say, oh, I forgot the scissors, if I turn my back on the sterile field, what could potentially be happening when my back is turned? There could be some sort of contamination. Patient might say, what is that the right side? Like that, we don't know, right? We don't know because our back is turned to it. So can't turn your back, can't leave the field unattended. We want to also use a 1-inch border around the edge of the sterile field, just to act as that buffer room, make sure we're keeping everything where it should be. The only areas of our PPE that are considered sterile, if we're using sterile equipment, sterile PPE, sterile gloves, sleeves, and the front of the gown above the waist. Back of the gown is not considered sterile, and below the waist is not considered sterile because it is too easy to brush it up against something, bump into something waist down. Again, if a piece of PPE that comes in contact with the sterile field that's considered non-sterile, we need to reestablish the whole field and start all over. And the same thing with the PPE. The PPE, if we touch something that's non-sterile, that PPE is now considered non-sterile, contaminated, start over. Keeping the area dry, moisture can be a source of contamination. And place items in the field in order which we're going to be used. So this will all make a little bit more sense next week when we start doing more wound care stuff. But again, I don't want to overload the first exam. So that's why I chose to break it up. So again, Direct wound care we'll look at next week. Removing dressings is something we will be doing, and it's absolutely something in all of the settings we could work in. Measuring wounds, if there is a wound, we're going to be measuring it because we want to be tracking progress. Applying medication, maybe debriding a wound, and then applying new direct dressing if needed. We can always ask for assistance from another professional, or we are going to be providing assistance to another profession. Just like I said, you hold the patient in sideline while somebody else works on the patient. PP protects the caregiver as well as the patient. We looked at disposable gloves. Latex is the most common. A couple of other materials can be powdered or non-powdered. Vinyl gloves have a higher failure rate, but they're preferred for brief patient encounters when dexterity is important. And latex allergies is another problem for both the caregiver as well as the patient. There is a special procedure to donning our sterile gloves we'll look at in a little bit. Sterile gloves we'll be using when we're providing wound care. And obviously, I think it's obvious if the glove breaks, we'll be replacing them, right? Oh, everybody stop, I gotta replace my gloves. But even if they're just heavily soiled, you might be able to say, okay, I need to stop. These are no longer good enough. And I think this is obvious, but change your gloves after patient care and before touching computer for documentation. I don't know why that's highlighted, but again, someone along the way said, I'm going to work with my patient, then I'm going to touch my computer, then I'm going to take the gloves off. Well, now the computer's contaminated for the next person too. We'll look at gowns. If gowns are needed, then so are gloves. That's just kind of an automatic. Could be man-made synthetic material, or it could be natural like cotton, disposable or washable. You'll see a bunch of different types. I think for the most part, we're using disposable in patients, but not always. And could be clean or sterile. I have a sterile gown in here. We also have just clean here. We'll look at the proper technique of that in a little bit. Masks, protection, the wear of inhalation of particles, or protection of droplets. N95 are better for when there's airborne transmission. We'll get techniques there. Eyewear. Eyeglasses are not considered personal protective equipment, so we'll need additional face shield or goggles. I prefer goggles over face shield. I got to tell you, I was with this one patient. I wore a face shield. He was partial spinal cord injury, 6'4", 330 pounds. Legs were his legs were a 2- on a good day, 2- out of 5 MMT score on a good day. And we're working on getting in and out of the shower. So, I mean, we're both doing a lot of work. I talk about being a lazy therapist all the time, and I definitely advise all of us to be lazy when the time is right. But this is one of those where it's like, okay, we're both working hard here. And my face shield, we're working in his bathroom, getting out of the shower. We're both working our tails off. We're both dripping sweat. And my face shield fogged up so much that I couldn't tell where his feet were. I couldn't see. So I couldn't tell if his feet were actually clearing the tub bridge or not. All right. Well, now I have somebody who's 6'4", 330 pounds and weak legs, not knowing if he's clearing and I can't see, like, what a disaster that was. So that's when I started switching to goggles. So there are some of those considerations that you guys will have that others do. Anybody's goggles, I know a few years wear master goggles, you know that they fog up right away or anything like that. So something to really consider. That was a scary day for me. All right, so sequencing to don. First step, hand washing. Next step, gown, then mask, then goggles or face shield. Lastly, gloves. To doff, gloves, eyewear, gown, mask, and then hand hygiene at the end. There is a technique where if we're going to be disposing of everything, where we can take off our gown and gloves all in one method. So that just depends on what, what are we using and are we getting rid of it or not? So first step, we'll go over just clean technique first, and then we'll go over sterile after that. So clean technique. All we're gonna do is you're gonna put this on. You will be taking this stuff with you, so try not to rip it as best as possible. Then either with a partner or yourself, you can tie your gowns both up top and down below. Why do we want to make sure both ones are tied? So it stays on you, and if it's not, the more it's loose, the more it's going to come in contact with non-sterile environment, right? Or non-clean environment. Next up is the mask. So taking the whatever mask we have, putting it on, and then making sure we pinch that little metal clasp to make sure that it's fitting tight over your nose. Make sure it's tight over here. Goggles, face shield if we then need it. There we go. And then next up, my gloves. Making sure that the gloves come over the cuff of the gown.
You're already following.
Already fogging, look at that. All right. Any questions with that? All right, so then to take it all off, we reverse order. Gloves, we're going to be grabbing the cuff and turning it inside out. And then with this one, we're going to come with our finger and grabbing the inside of the glove and then turning it inside out from there. Then we'll move eye protection, then gown, and then mask and respirator. Now, I do want to show you the all-in-one technique for the gown and gloves. All right, so if we're going to dispose of it, it's easy just to rip these. Again, you guys are going to be keeping these to practice with, so don't rip them because you'll be using them for at least another week or so. So then from there, we get to pull, and now we want the whole gown and the sleeves to go inside out. And then from there, we get to get rid of the gloves inside out as well. Okay.
We're disposing everything.
Disposing of everything. Yeah. Yeah. If these were clothed to be laundered, then we don't want the gloves to be trapped in the thing that's going to be laundered because the gloves are never, we don't have washable gloves. So, all right. So let's start for now with just the clean technique stuff. Okay. This is probably what we're going to be using most often in our careers. Once we get a little handle on that, we'll take a step up to the sterile gloves and gown. Okay. All right, let's go. All right, so yeah, just more reps, and guess what? I mean, sometimes it happens, and you just have to adjust your techniques from there. So, did everybody get to practice just gloves though? Because that's definitely going to happen at least once a day during your career. You're gonna have to take gloves, put them on, and take them off appropriately. So, pinch the cuff on one, get it inside out, go underneath of the cuff on the other, get it inside out. How come you don't go underneath the cuff on the first one? Because you already have the gloves on, now you're, whatever's on the glove is now on your skin. So yeah, no contact in that environment. All right, I'm gonna show you a little bit a preview of next week when we start talking about more wound care stuff and the aseptic field and donning our sterile technique stuff. Now, I am going to ask Tony to keep her eyes on me because I know I'm going to make a mistake. Because the only times I've had to use sterile gloves and a sterile gown has been in this room. Have you had to use it professionally?
No.
Even when I observed surgeries, they didn't ask me to wear sterile equipment for that
And
surgery.
I've been in surgeries too, and I want sterile.
Yeah.
Why is that okay? Because you're just nowhere near the.
Yeah, you're way outside, like.
For a couple of the surgeries, I had to stay very far back. For one of the surgeries, the surgeon said, "Hey, Josh, come here," and I was this close to the patient. So, yeah, I don't know.
What happened with that patient? What happened with that patient?
They did great.
Yeah. I think part of it too is like, sterile equipment is one thing, but if you're not in a sterile environment, it's really only sterile when it's just when it's coming out of the package. After that, it's
Yeah.
sterile, you know.
Yep.
So like my wife talks about that, and really it's like, you know, we have to use like sterile equipment, so like if they're taking out a catheter or something
Sure.
out of the package, if it doesn't get used, it still has to get thrown away.
Absolutely.
So,
Yeah.
But it's really like, it's a clean environment, you know? and
Yeah.
Best you can in someone else's home.
Yeah, and in the home care, we do the best we absolutely can. In the hospital, we get to be a lot more protective. So I'm going to show you a little bit of preview for next time. So the preview for next time is we're going to be performing wound care. The first step is going to be removing dressing with clean gloves, non-sterile gloves. Then we're going to be deciding to measure either with a clean environment or sterile. There's techniques I can measure without coming in contact. If I need a perfect measurement, I would have to then become sterile to do it. So I think the thing for this is making sure we have all of the equipment first and setting up our environment. So first thing I'm going to do, we have this towel here. We'll lay it out and we'll call this my sterile environment. And that means I need to have a 1-inch border on the outside. Make sure I remember that. So there's my sterile environment. Now, I'm also going to need strips of tape at the end. So I'm going to give myself a handful of strips of tape ahead of time in my non-sterile environment. That'll be the last thing that we really have to do, but I want to make sure I prep ahead of time. So my non-sterile stuff goes over here, keep my non-sterile separate from my sterile, right? All right, so then I want to lay out my sterile fields. The order of, the more organized I can be, the better everything will be. So I want to lay it out in the order that I'm going to use it. So my first step would be, the sterile part is going to be to apply medication with my sterile swabs here. So I would open the package and drop them in. My next step would be my sterile gauze. Again, open it up, drop it in. And my last step for this part, the sterile piece, would be to have my sterile wrap, open it up, drop it in. All right, non-sterile stays away, sterile field is there. Now, the next step I have to do is apply my sterile PPE. For this, I will go gown next. I'm going to skip the mask and respirator for now, and we'll go into the gloves after that. So, get rid of this stuff. All right, yeah, let's see how I can screw this up. So these are packaged in a way that you can touch one area of it without breaking. It's the inside of the gown should be the thing that's facing you. Okay, so to open that up, you ask your assistant to open it up for you. The same thing with the goniometers, the stacked arms. I just can't do it. So there we are. Thank you. My son knows if he wants to get a sticker off, he knows that's my wife and not me. It's like, if you want to wait around for an hour, man, we can work on this together. Perfect. Make sure that's the part we grab. It's not the other side.
This is wrapped in a towel.
Oh,
Remember that
gotcha,
one?
gotcha.
Yeah,
Yeah,
that
yeah, yeah,
towel
yeah.
that they use
Yep.
as, so I think you're okay. You still have some wrapping to do. Yeah, you're okay as long as you're.
Yep. All
Yeah,
right,
yeah.
perfect. There we go. There's that. Here's another sterile field they give us if we wanted that. All right. Sure. Yeah.
It's gotta be.
Yep,
because-
because it's wrapped
And I think there's something right there. I think that's where you want it.
right here.
Yes, not inside, outside.
Right
Yep.
here. Perfect. All right, there we go. All right, so yeah, you're right. So that you guys see where
So it's actually inside out.
that's
so that
the inside
The pot that's going
part
in.
there, right? All right. So then we're gonna start unfurling. Inside is going to be okay to touch. We'll unfurl. Then we get to put it on. Perfect. Then either with an assistant or they give you this little tab that you get to hold on to then you can pass the tab and then tie to the side, okay? For now, can you get the top one?
So these have Velcro on them rather than a tie, which makes it a little bit easier. Is that good?
Yep, perfect. All right, next up, gloves. Same thing, we're gonna be opening our gloves, maintaining the inside. They're gonna be in the package as well. Open them up. And we're gonna make sure that it's facing the left and right are appropriate for us there. We got to then open it up. Perfect. So when you guys do get to your sterile gloves, you'll see that the cuffs are folded inside out, so I can hold on to that stuff. It's a little bit easier for the first glove than the second one. I always have a lot harder time with, but I can grab the inside cuff and I'm okay because it's, like I said, it's inside out. As long as I don't touch any other aspects of it, I can be here. Talked to Big Game, said that this first glove was easy. This thumb is buried on me. There we go. All right. So we want to make sure again that they are curled up over our gown as best as possible. Now the next glove, what we've got to do is I don't want to touch my sterile glove to that inside cuff. If it's sterile right now, I can do the initial pickup because everything's still sterile. But I have to be really careful on how I start doing this. So I start putting this on. Thumb again. And there we go. All right, so there's my donning of my sterile gown and gloves. Any major errors?
No.
Ah, look at that. Not bad this year, huh? All right. And then to take everything off again at the end, it's the same procedure we just had. Now, once I'm sterile, the patient's already, their wound has been exposed. Now I get to apply my medication. Oh, you know what I didn't do? I didn't open up the medication.
But your
Look
assistant
at
is
that.
here.
Right, so then I can apply medication. What's that? Yep, don't reach across the sterile field. I wouldn't want to reuse this over and over again as a one-time use, right? Grab medication, throw it away. That's why we got another one. Then I would apply the gauze and then I would wrap with sterile gauze and then wrap it with the ACE wrap, tape it at the end. So that's a little preview of next week. Right now, today, what I want to focus on is the sterile glove technique. You can mimic everything you with the gowns that you have, fold them up and see if you can just touch the insides to put them on. It's a little bit extra things to think about, but the gloves I think can be important. Okay. All right, let's practice all of that stuff. Okay.
Second hand. Here. So my first hand, I put on my right hand because I'm right-handed. The second hand, and don't forget, I'm just doing it without so that you can see it. So if you take your fingers and you put them all 4 fingers under that cup, and then you slide it over your fingers and you put your thumb in, okay? Then you have all of this to pull up over the cup, and it makes it really easy. Okay, to get that second one on.
All right, so last couple things. Disposal is the next thing to just be aware of. Contaminated disposable items should be placed in carefully labeled containers. Sharps disposed of puncture-proof containers as well. Again, that's going to be an unusual experience for us, at least professionally. Don't recap, bend, or break any needles. Cloth items that will be washed should be placed in leak-proof, clearly designated bags to be washed. Couple of things, different levels of cleaning. So sterilization is used to destroy all forms of microbial life, including high levels of bacterial spores. So you could do a steam under pressure, gas, dry heat source, or immersed in an EPA-approved chemical sterilant for 6 to 10 hours. That's only used if for any tools that can't withstand that high heat. Disinfection is mostly what we'll be talking about. 3 levels: high level, intermediate, and low level. High level destroys all microbial life except for high numbers of bacterial spores. Hot water at 80 degrees Celsius to 100 degrees Celsius for 30 minutes, or exposed to one of those sterilants for 10 to 45 minutes. Good for reusable items that contact with the patient's mucous membranes, different tubes, endotracheal tubes, a good example. Intermediate destroys most viruses, most fungus, vegetative bacteria, and tuberculosis bacterium that does not kill bacterial spores. Hospital-approved disinfectant contains at least 500 parts per million available free chlorine. That's household bleach, 1/4 cup per gallon of water. That's the intermediate level. And what we will be responsible for when we're cleaning, the tables and things like that with our patient's equipment, that's what we'll be responsible for. Low level is just routine housekeeping, destroys most bacteria, some viruses, and some fungi. Contamination, when using any technique to destroy or remove bloodborne pathogen, make sure we protect ourselves, especially gloves when using harsh cleaners. All right, so that's it. There's your review. Any questions?